This is the PALS Skill Learning Station. And the scenario we have is EMS providers arrive with a 6-month-old with altered level of consciousness. The infant was reportedly picked up from daycare and slept during the car ride home. Her father reports she was unable to take her bottle. The infant lies listless in her father's arms. The EMS providers were unable to establish a peripheral IV access. Ready?
Okay, so my team is here. We have our PALS, our Broslow cart available with the IO ready to go, because those are a few first things that are crossing my mind. So I'm going to start with the airway breathing assessment. Have I got my vitals?
Your vitals are, the heart rate is 160, blood pressure is 84/30, respiratories are 10 to 18, SaO2 is 93% on room air, temp is 98.6, they weigh 8.6 kilograms, and they're 6 months old.
Okay, so as far as airway, her breathing isn't adequate, so I'm going to apply 100% oxygen nasal cannula, and I'm going to have the bag valve mask set up and ready to go in case we need it. So there's my airway breathing. Circulation, skin assessment.
There is some modeling on her lower extremities.
Okay, and I'm going to check the pulse. Our pulse was 160 on report, so she's got a good pulse. Color's not good. Hopefully the oxygenation will help with that, but we're going to go ahead and I'm going to get someone to do IV access and put an IO in for her.
Right, we got an IO established.
Okay, blood pressure, she needs a little bit of a bolus. We're going to start a fluid bolus with normal saline. ACD, okay, I want to do a neuro assessment. I'm going to look in my baby's eyes. Pupil assessment. Otherwise, neuro assessment wise, level of consciousness, baby's lethargic. We're doing all of this stuff and baby's not responding, which is not a good sign. So,
right.
I'm looking at some, and the fact that they picked him up from daycare and she's been pretty lethargic since then, I am questioning non-accidental trauma. Or accidental, I guess it could be, but does it give a pupil assessment?
It doesn't say
Okay.
in here, but just it reiterates that she's pretty lethargic and unresponsive.
Okay. What do we need to do? I would have her covered with a warm blanket just to keep her warm.
I have an update.
Okay.
She's lethargic, responds to pain. Pupils are 4 millimeters bilaterally and sluggish but equally reactive to light.
Okay. Okay. I'm gonna check a glucose also. Does it give me a value for a glucose?
It just says to check the glucose concentration and treat hypoglycemia if needed.
Okay. Okay. So at this point, they're not bagging the airway. I have 100% oxygen on. I don't know if that helped or didn't, but they're on standby with the bag if they need it. Because of the baby's decreased GCS, we should talk about with the doctor whether we want to do definitive airway, because the baby's not going to maintain their airway at some point. I would repeat a full set of vitals to check how that blood pressure is doing after a bolus.
Okay, on our secondary assessment, it says to repeat our vital signs after oxygen and fluids. So her heart rate is now 140, respiratories are 30. They did decide to bag mask her a little bit. The SaO2 is now 95% with 100% oxygen on during bag mask ventilation, and the blood pressure is now 80/50. So head, eyes, nose, throat, and neck. The anterior fontanelle is open, soft, and flat. There is bruising to the ears. Heart and lungs, rapid rate, no extra heart sounds, lung sounds clear. Abdomen is distended, scattered bruises of various ages. Patient cries because of light touching to the abdomen. Bowel sounds are absent. Unable to appreciate any hyposplenomegaly. Extremities, normal skin turgor. Back is normal. Neuro is still lethargic. Pupils are 4, equal sluggish to light.
So I would repeat a fluid bolus based on her heart rate came down, which is good. I'd repeat a fluid bolus one more time, and we need to talk about the bruising and signs of abuse. You would want scans at some point, but I think right now she's not stable enough to go anywhere for that. I still think with a 95% oxygen, we need to talk about a definitive airway. She's still lethargic. I would probably, depending on what doc wants to do, probably go ahead with a RSI intubation. She still has a pulse, so we're not doing compressions. They need to check for transport.
Yes.
They need to consult and get the baby out of here because we didn't want this.
Hit our easy button and get this baby
Help.
to where she needs to be, and then hold whoever did this to her accountable. That's it.
The cops.
Yes.